Hi, this is your Houston Chiropractor Dr. Gregory Johnson. Look who's back in here with us this week, Daniel. And if you remember, Daniel came in last week complaining of severe low back pain and sciatica all the way down his left leg. But he has a lot of issues right here in this left sacroiliac region as well. And that's why he came in this morning. He told me he's feeling a lot of tight muscles all the way around his ilii, or ilium on that left side there. But he's not getting any shooting leg pain down further than that, right? Well, he's still out of place and he still needs to be adjusted. So this is his second adjustment for this condition. So let's show him what we got this morning, Daniel. I'm gonna have you flex your head forward and backwards for me, please, sir. I've already looked at this, but we'll show them. Okay, take a look in the mirror. Your head's pretty much right down the center. The only thing that we're seeing aberrant is the space here between this arm and this pelvis and this pelvis. So your pelvis is translated to the left of center. And I think that's why you're getting more stress on this left SI joint down here. Okay, so let's do this one first today then, Daniel. You want to grab one and I'll grab the other?
Oh.
No, I'm just kidding.
Okay.
Usually wives really want to do that. Okay, get down a little bit so you don't have to hop up there. There we go. All right. Now these conditions are never any fun, and you know, there's no guarantees of result with any patient. We're just going to do the very best we can for him. Let's move that pelvis this way. There you go. Slide down maybe about an inch. A little bit more. There you go. Perfect. Okay. Tell me if you still feel that whenever I lift your legs up with this table that you told me a few minutes ago about that tightening up when your legs come up.
Right now, I don't feel like a tightness, but maybe slightly.
Okay.
Like,
Tighter than what it was?
no, I think it's less tight.
Okay. So, do you have your legs up parallel like this?
I did.
You might have them up a little too high. If you go too
Maybe.
high, that puts more stress down
Put
here.
it on a laundry basket. But
Yeah, you just have to make sure when you look at him when he's on that, make sure his legs are parallel with the floor or the bed or the table or whatever he's on. And then, okay, let's rest these guys here, Daniel.
I notice you have more of an angle.
Make sure you keep Daniel in your prayers for his healing, because we're really trying to keep him out from having to have back surgery. Because I don't think it's his disc as much as it is his left SI joint. Nice deep breath. There it is, right there. Well, that was even deeper than your first one, by the way.
oh yeah, I felt that.
Yes, sir. Well, look there, you're not shaking as bad today on that.
Yeah, it took someone's. I wore long sleeve shirts today. I think
There you go.
it's
Okay, tilt left just a bit. Perfect. Just like that. I like your shirt, Superman. One of my favorites.
Give me some encouragement.
Yes, sir. That's right. He's stronger than Batman, so keep that one. There you go. This way. Let me lift this down a little bit for you.
That actually felt really good.
Good. Good. Okay, let's have you lay on your tummy next, please, sir.
This is the one that can be a little painful, but we'll see.
Hopefully it won't be as painful today.
Oh.
That ring there is going to be your salvation right there. Yeah, left leg's still short by half an inch. You see that? Now that probably tightens up a little bit in your low back.
Yeah.
See, that's your left leg's short, but it got half inch longer when I brought it up. So I'm going to adjust that left SI joint again. See your sacrum, I don't know if you can feel this or not. Do you feel that it's more protruded on this left side than it is over on this right side?
Sometimes it's sore when I lay on it.
Yeah. So I'm gonna put extra superior to inferior adjustment on your sacrum. There's L5, that's L4, L3, L2, L1. Now, it was probably more sore for me to adjust your sacrum than it was your lumbar spine, I bet.
Yeah.
So that tells me again that it's mostly coming out of his sacrum and his left SI joint. Okay. There you go. Okay. That's it. And I got part of it, not all of it. I'm sorry, I gotta get my elbow in there.
Yeah, put it as long as you take my pain away.
Keep breathing. You'd sell it pretty cheap, wouldn't you?
Oh, yeah. Put as much pressure, I'll take my pain away as you want.
Okay. Now see, I bet this more sore in your pelvis than it is here in your lumbar spine.
Yeah.
So that continues to clinically assess that it's more your sacrum and your SI joint than it is your lumbar spine. These guys are gonna be really sore out here. Like right there.
Oh, yeah.
All right. Lift your head up in this next one. There you go. Okay, let's turn you on your back, please, sir. Take it nice and slow. Well, you're sure moving better than you were that first day. Okay. Yep. Okay, slide down about an inch. And put both arms out, palms up. Yep. There we go. Good. Okay. This one here is probably going to help a lot too. Try to let this leg go for me if you can. There we go. Sure off there. Stand here. There we go. You feel that one up there?
Yeah.
Okay, let's sit you up sideways and face up that one. Let you sit up, whichever way is easier for you. There you go. That's the way to get up. You're a quick study. I like that. There you go. That's it. So your homework for this week is going to be to find you a kind of a box or a closed basket that has your legs parallel to the floor.
Okay.
You might have had them up too high or a little bit too low,
Maybe.
which rotates your SI joint even more. There we go. Yes, sir. Okay, let's stand here in front of you. All right. There we go. Okay. And these guys here, and the head way back here. Okay. Flex your hip forward and backwards again, Daniel. See if this feels any smoother to you in your neck and upper back.
Oh, yeah.
Try to do that little stretch you were showing me that test your SI
Oh.
joint. See if that
Right here. Yeah, that feels better.
one feel any different.
Does, yeah.
Okay, good. Well, we're going to follow Daniel's progress as long as he is so kind as to let us do so. Keep him in your prayers for healing of his SI joint pain and his left sciatica, because we're praying for him and his healing as well. So this is your Houston Chiropractor Dr. Gregory Johnson coming to you from Advanced Chiropractic Relief in Houston, Texas. We'll see y'all soon.